All of England's COVID restrictions, including the requirement to self-isolate following a positive test, will be lifted in the next couple of weeks. Alongside this announcement, a recent study has found a new variant, Omicron BA2, has emerged in 6 African countries, Denmark, and also the UK. Now, it's thought that this new subvariant is substantially more transmissible, so the pandemic is far from over. As the spread of this new variant continues, there is currently insufficient evidence to determine whether BA2 causes more severe symptoms than Omicron BA1. However, experts are warning that we must remain vigilant and continue with vaccinations, mask wearing, social distancing, hand washing, and other transmission-reducing measures. Most importantly, they advise that we continue to test regularly with lateral flow tests and, crucially, with PCR tests if symptoms develop. Solis BioDyne is a global biotech company based in Estonia and is a world leader in the development of accurate, room temperature stable reagents and enzymes, which are used in PCR test kits all over the world. Since the start of the pandemic, they've provided these to biolabs in over 110 countries, allowing them to develop the most accurate tests and kits to detect all COVID variants. When Omicron was designated as a variant of concern by the World Health Organization on the 26th of November 2021, it was quickly confirmed that Solis BioDyne's very own IVD-grade reagent SolisScript one-step COV kit could not be tricked by the various mutations, and so played a pivotal role in COVID detection. And in addition to this, their forensic testing tools not only detect COVID, but also HIV, influenzas, and a whole host of viruses. Now, it cannot be reiterated enough just how important testing is as we continue to manage this pandemic, and the same things that proved effective at the outset are still very much relevant today. Through observing various restrictions and following a range of sensible guidelines, we've been able to somewhat mitigate a serious global health crisis and have now cautiously returned to something resembling normality. However, we must remain vigilant. Dr. David Nabarro, COVID special envoy to the WHO, has said that if we were running a marathon, we would only just be reaching the halfway point. So caution is most certainly the watchword. Now, today we are joined by Stefan Goldenbaum, CEO of Solis BioDyne, to discuss the amazing technology behind PCR testing, which will help us carry on detecting new variants. So, Stefan, thanks so much again for joining us this morning. And could you please tell us in as much detail as you can, why is PCR testing still so important at this phase of the pandemic?
Hello, first of all, and thanks for having me here. Directly to your question, why is PCR still so important nowadays to perform? PCR by far gives the most accurate and most specific answer about patients having a COVID infection or not. When we compare it to current methodologies that are used, then we have to also look into what does it do against antigen tests, for example. PCR tests by far can not only tell you if it is a yes or no answer, a patient has an infection or not. It's very often, and we have seen it in the past due to the critical situation in hospitals to some of the patients. It is very, very important to also say at a certain stage where and how far the infection is already with a certain patient. And this is what PCR can perform and shed light into. When we compare to antigen tests can give you a yes-no answer only. Very often, based on the lower level of accuracy, you see false negative tests, and these are very critical because a false negative test means a patient has an infection. The result shows you a no, and then people with a positive infection or with an infection roam around in public, be it in supermarket, in the mall, or in an event, and they infect others, and then you have another super spreader event, and you are back to ground zero. And this is something you could avoid certainly with PCR testing.
Excellent answer. And how do PCR tests work?
Let's shed light first of all into what does PCR stand for. PCR is polymerase chain reaction, very bulky term in biotech and molecular biological world, very common. We use it almost every day in the laboratories. And in a nutshell, it's a copying machine, a copying machinery with different components. The building blocks, and every organism, it does not mean only COVID, it has also other viruses and bacteria and human and plants. Every organism has a genetic material. And this genetic material has 4 building blocks. Let's say these are our 4 cartridges, 4 colors that you would like to copy. And only if you have something on the printer or a copying machine and you use the machinery, then you also see something coming out of the copying machine. And then you need to add enzymes. And these enzymes is what we do, where we come in from Solis BioDyne, and what we do for the past 27 years already now, that we develop and produce different versions, different kind of forms of these enzymes, this machinery, and all of these components put together. You know, the cartridges as the colors, the enzymes as the machinery, create then a genetic sequence copying machine where you are able to create millions of copies of this virus, for example, this all in laboratory condition. And then you can detect the virus where you have a very accurate form of answer, where you can also accurately say, in many cases, this is one variant or another variant, for example. And that makes PCR so powerful.
Could you please tell us in as much detail as you can, how exactly are new variants detected? What's the process?
It's a good question. I would like to start a little bit. What are variants, to give an overview about this? All of the organisms, humans, plants, bacteria, viruses, they have genetic material. And variants, what we call variants, is nothing else than evolution. So from generation to generations, all of these organisms I just mentioned, they evolve, and that also means change in genetic material. Why does that happen? It's a random process. This is something that we see everywhere in all of the organisms. And this is what we cannot detect too much with the PCR. We need to adjust our PCR to variants, but really detection of variants is done more by sequencing. And sequencing is another methodology. It's also next generation sequencing. As the name says, it's a more modern form of sequencing. These are the most 2 common methodologies to detect variants. Is comparable to read a book letter by letter, for example. You do that and compare multiple books, and then you find typos in different books, and this is how you detect then, by reading the genetic sequence, variants and also mutations. And these mutations are normally categorized. They are stored in global catalogs that are transparent for all of the research and diagnostic world. And based on also these variant detection, then other methodologies like PCR are adjusted step by step to be always on top of the game, also when it comes to new test methodologies and PCR tests.
Excellent. And could you please tell us a bit more about the work of Solis BioDyne in World Health on the global platform, let's say?
Yep. For sure. When we look at what we do and what our team is doing, what we do since 27 years is with our enzymes. And this is unfortunate to somehow see it these days. The diversion of the topics very, very much diverted here towards COVID testing only. But the field of testing with PCR is very rich in what you can do with our products. We are active in HIV and HPV testing, for example. A simple influenza detection, something that happens regularly. That what we have seen in the past as a very, very regular kind of disease detection. Almost nobody seems to talk these days about influenza. These are the fields where we are ranging in terms of infectious diseases. Nevertheless, we are also very active in cancer detections. Also, cancer have variants. And here we are also able, with our PCR solutions, detecting and shedding light into different kind of cancer genetics, forensics, victim identification. And very important, also happening every day, food and agricultural testing for food security, for prevention of food contamination. This is where our products can be found, and this is also where we have partners and corporations across the world.
Great stuff. And where can listeners go for more information?
For more information, you find for sure everything you want to know from a technical and product perspective on solisbiodyne.com. This is one of the key sources of what we do. And if you would like to see and read a little bit more about what our people are doing, what are we doing for our people, with our customers and around the globe in terms of events, then also feel free to find us at LinkedIn, follow us there to be up to date of the latest news and read our news feeds.